Welcome everyone. I'm Dr. Ashraf Amir. I'm a consultant in family medicine. Today, we will be discussing medication overuse headache and its growing relevance in primary care practice across the Kingdom of Saudi Arabia. Migraine is increasing recognized as major public health burden in Saudi Arabia, affecting the quality of life, productivity, and healthcare utilization. Our discussion today, ladies and gentlemen, will focus on how primary care physician can identify patient at risk, prevent progression to chronic migraine, and support the patient throughout recovery using practical, culturally relevant approach. For this, ladies and gentlemen, we are honored to have our guest for today, Dr. Sarah AlMuammar. She's a consultant in family medicine and associate professor. So welcome, Dr. Sarah. And my first question for you, Dr. Sarah, how important is medication overuse headache in Saudi Arabia today?
I think we're seeing it much more often than we're used to. Migraine itself is very common in Saudi Arabia, and in primary care we see many patients trying to manage it on their own before seeking medical advice. It's not unusual for a patient to rely heavily on over-the-counter painkillers like ibuprofen, paracetamol, especially during stressful periods. We often see this in working adults, mothers balancing family and work, university student, and anyone really dealing with poor sleep or ongoing stress. The real challenge here is that the many patients don't realize that taking these medication too often can actually make their headache worse over time.
Okay, Dr. Sarah, this was very clear. I really like it very much. But let me ask another question now. Can you explain the clinical definition in a practical way for primary care physician?
Of course. The official definition comes from the International Classification of Headache Disorders. But in practice, it's actually quite straightforward. If a patient already had a headache disorder and start having headache on 15 or more days each month, while also overusing acute headache medication for more than 3 months, we should think about medication overuse headache. I'd say as a general rule, triptans, opioids, and combination painkillers become high risk when they are used more than 10 days a month, while simple analgesics such as paracetamol and ibuprofen become a concern when they're used more than 15 days per month.
Okay, Dr. Sarah, let me ask you another question, which could be very practical for our primary care physicians. Are there a specific patient profile you commonly see in your clinic?
Yes, there are definitely some patterns. Women with migraine, especially between the ages of 20 and 40, are commonly affected. We also see higher risk in patients with poor sleep, anxiety, depression, obesity, heavy caffeine intake, and even young adults with irregular sleep schedules and prolonged screen time. Interestingly, during Ramadan in particular, we often see patients experiencing headache related to dehydration and caffeine withdrawal, which can lead them to increase their use of pain medication and potentially contribute to medication overuse. Another group to which the patient who continue treating themselves with over-the-counter medication for months before seeking medical advice, by the time they come to us, they're often already caught in the cycle of the medication overuse.
Okay, Dr. Sarah, do you think that patients generally recognize the medication themselves may contribute to worsening headache?
Not usually. Most patients truly believe they're treating their headaches appropriately. So they're often surprised when we explain that the medication itself may be contributing to the problem. That's why taking a careful headache history is also important. I routinely ask how many headache days they have each month, how often they're taking their medication, and whether they're needing it more frequently than before. Of course, I also encourage patients to keep a headache diary. It's one of the simplest tools we have, and many patients begin recognizing the pattern themselves once they track both the headache and the medication use.
Okay, Dr. Sarah, let's go to discuss the subject from different perspective, which could be very important for us to understand. Which medication or what medications are most commonly overused in Saudi Arabia here, according to your clinical practice?
The medication we see most often are ibuprofen, paracetamol, and combination analgesic that contain caffeine or codeine and even triptans. One thing that's particularly relevant here is caffeine. Many of our patients already consume quite a lot of coffee or energy drinks. So when caffeine-containing pain medication are added, especially during periods of poor sleep or fasting, it can further contribute to the cycle.
Okay, thank you so much, Dr. Sarah. It was well said. But let me ask you a question. Could you walk us through a patient case that reflects what we commonly see here in our clinics in Saudi Arabia?
So yes, I recently saw a 34-year-old working mother with episodic migraine who goes through a particularly stressful period at work, while also, of course, managing family responsibilities. She started taking ibuprofen more frequently just to get through the day. Initially, it worked, but over time, the headache became more frequent and she ended up taking even more medication. When we reviewed her headache pattern together, she realized for the first time that the headache and the medication use have been increasing side by side. From there, we worked on reducing the acute medication use. We worked on improving sleep, hydration. We managed her caffeine intake, and we even discussed preventive treatment for migraine. And of course, with regular follow-up, she experienced significant reduction in headache frequency over the following 2 months.
Okay, what about patients who already meet the criteria of MOH, medication overuse headache?
So for those patients, management require patience and strong physician-patient communication. The first step is always patient education. If a patient understands what's happening, they're much more likely to stick with the treatment plan. I usually explain that the headache may temporarily worsen as we reduce the overused medication. But this is a normal part of the recovery process. Management usually involves reducing or even stopping the overused medication, optimizing sleep and hydration, addressing contributing factors such as stress, anxiety, and maybe even starting preventive migraine treatment when appropriate. Of course, there is also a regular follow-up, specifically during the first few weeks, and family support can make a real difference in helping patients stay on track.
So, Dr. Sarah, you have mentioned a very important point here, the doctor-patient relationship, which is very crucial in the management of patients with migraine. But let me ask you, how can Saudi primary care physicians improve the long-term outcome of the patients with migraine?
So primary care physicians are an excellent position to prevent medication overuse headache before it becomes established, as they are usually the first point of contact for these patients. There are simple steps like simply asking about headache frequency, reviewing medication use at every visit, encouraging headache diaries, and educating patient about safe medication limits can make a big difference. It's also important to look for contributing factors such as poor sleep, anxiety, or depression, and to consider preventive treatment or even referral when headache becomes frequent or disabling. Of course, the earlier we recognize the pattern, the easier it becomes to prevent the progression of chronic headache.
Thank you so much, Dr. Sarah, for this valuable discussion. Medications overuse headache is clearly an important and growing issue in Saudi Arabia, particularly with the rising migraine prevalence, lifestyle stressor, and widespread use of the over-the-counter medications and analgesics. But again, you have mentioned a very strong statement. You said primary care physician has been positioned to be in a position to handle these medication overuse headache. So this is a hope that we can do much better by knowing more about the medication overuse headache. So it's not all about working hard, it's about working better this time. Okay, thank you so much, Dr. Sarah, and I would like to thank you all, the audience, for being with us here. My message is, the encouraging message is that medication overuse headache is both preventable and treatable. And as a primary care physician in Saudi Arabia, we are in a unique position to recognize it early through patient educations, timely intervention, and collaborative care with other specialties. We can help patients break the cycles of medications overuse, prevent progressions to chronic migraine, and ultimately improve their quality of life. So thank you very much, and wait for another episode to come. Have a good day.